Welcome back, everyone. My name is Yusuf Farrell. I'm a pharmacist in the United States, and today we are continuing our series on every hormonal contraceptive in the United States. In our last video, we finished up our discussion about oral contraceptives, and now we are going to discuss some more unique formulations out there. These formulations are meant for patients who may not prefer to take a daily option like the pills, or who maybe want a more longer lasting and potentially more effective option compared to the pills. Today we are going to discuss the patches and the vaginal rings. Otherwise, let's get started. So birth control patches are a non-oral option that is applied weekly instead of taken daily like the pills. What will happen is that the patient will, when they get a prescription for patches, they'll receive a box that has 3 patches inside. What they'll do is that on the day of their choice, the patient will apply a patch to the body. Where they apply that patch is up to them. They have a few options. They can apply, for example, to like the back shoulder, to the upper buttocks, or to like the hip area next to the vagina. And what they'll do is that they'll apply the patch and they'll leave that patch in place for an entire week, 7 days. And then when the next week rolls around, they'll remove the old patch and put on a new patch. They'll do this for 3 weeks or 21 days. And then when the 4th week arrives, they will take off the patch and they won't apply a new patch. This will be their placebo phase. So as you can see, it works very similarly to the oral contraceptives, but instead of the patient having to take a tablet every day, they could just apply a patch weekly. There's currently 2 formulations that are available to patients in the US. You have the first formulation, the more commonly known one, which is a combination of Norelgestromin and ethinyl estradiol. It comes under brand names like Zefamy and Xulane, for example. And then you have a newer patch that came out a few years ago, which consists of levonorgestrel and ethinyl estradiol under the brand name Twerla. So these patches are extremely effective. They have a failure rate similar to the oral contraceptives at around 9%, which means that for every 100 women taking the patches, we expect 9 of them to experience pregnancy even while taking it. And also a good thing about the patches is that based on how patches are, they will release the hormone steadily, which can be very great for patients who may have experienced adverse events from before when taking a pill. Because looking from like a pharmacokinetic standpoint, let's say, when someone takes a pill, the concentration of the drug basically spikes. It just shoots up. And that could cause certain adverse events for patients, such as like bleeding or spotting, for example. By having a system that releases hormones steadily, you just get a nice baseline level that doesn't increase suddenly and can be more well tolerated by patients. But there are some downsides to this formulations. The first one is that it is contraindicated in certain patient populations. For example, patients who have had a history of cardiovascular disease, patients who smoke, because smoking can interact with the ethinyl estradiol and cause an increase in adverse events, for example. It's also contraindicated in patients with a BMI of 30 and above. So I'll really quickly explain what BMI is. So BMI, or body mass index, is essentially a calculation where we divide the patient's height over their weight. While the calculation does have its flaws, it's very commonly used. You'll see a lot of formulations and medications using BMI as sort of a way to kind of show what the dosing should be in specific patients. Now the idea is that in patients who have a higher BMI, 30 and above, let's say, there's essentially, they have more quote-unquote body mass compared to other people who don't have that same BMI. But that creates a situation where they may need more drug to actually reach the increased body mass. They need more drug to have the same effect. Because at the end of the day, the drug has to reach everywhere. It has to reach everywhere in the body, has to have an effect everywhere in the body. And if you have a situation where the dose is not high enough, it's not going to reach everywhere, and it's not going to be as effective. That's why you see that sort of warning about BMI. Getting back to the patches, between the 2 formulations, the levonorgestrel ethinyl estradiol formulation, or Twerla, does have a lower estrogen dose, It just has a lower dose in general compared to the Norelgestromin and ethinyl estradiol patches. So it can be beneficial in patients who may have experienced certain adverse events on the higher doses. But keep in mind, levonorgestrel is more adrenergic, as we mentioned beforehand, so patients could experience side effects from that. And norelgestromin is less adrenergic, so it really comes down to what the patient prefers and what they can tolerate in terms of adverse events and just their goals for therapy. So next we'll discuss the vaginal rings. They work basically the same as the patches, but instead of the patient applying a patch to the body, they'll actually insert a small ring into the vaginal cavity. Now these rings contain the same ingredients as the COC and as the patch. They contain a progesterone and a estrogen component, and they work the same way. A ring is inserted, left there for up to 3 weeks, and then it's taken out for the 4th week, and there's no ring left put inside during that 4th week. So that's their placebo phase. The ring is very small, like the ring I would say is like maybe this big, maybe a little bit smaller. I'll just show a picture here, but yeah, it's an extremely small ring. Patients shouldn't feel it once it's placed, and their partners shouldn't feel it once it's placed correctly. Best thing I could really compare it to would be like an IUD, where it's placed and it's kind of like you forget about it for 3 weeks. Otherwise, it works pretty much like the patches and the oral contraceptives. It will secrete the estrogen and progesterone for 3 weeks in this case, and then the patient will take it out for the 4th week. So there's currently 2 formulations available in the US right now for the rings. You have the first formulation, which contains a combination of etonogestrel and ethinyl estradiol. It comes under a few brand names. You got like Nuvaring, Eluring, or Haloette, for example. And then just to give a quick explanation about etonogestrel, this is a newer progesterone that's also in like that 3rd gen classification. So it's going to be less adrenergic compared to levonorgestrel, but less potent than levonorgestrel, fortunately. So it has less side effects, but the thing is, it's very commonly used in vaginal rings and these other formulations, specifically because it just has a higher efficacy in these more unique dosage forms compared to other progesterones. So that's why you'll see it very commonly used. And then the other formulation, which is newer, also came out a few years ago. It contains Segesterone, so that's spelled like Segesterone. Contains Segesterone and ethinyl estradiol under the brand name Annovera. So this same thing, it's a ring that's implanted for 3 weeks and then taken out on the 4th week. But what makes this different is that the ring could actually be reused for up to a year or 13 cycles, if we assume 28-day cycles. So the patient will follow the same instructions as any other ring, where it's 3 weeks in, 1 week out. But what they'll do is that they'll leave the ring out for that 4th week, and then when they're supposed to implant the ring again, they can actually clean the same ring. They'll keep it around, they'll clean the same ring, and then they can actually reinsert the ring again. So instead of a patient having to get a new ring every month, they can just reuse the same one for basically an entire year. A little bit about Segesterone. Segesterone, it's also a newer progesterone. It's not available orally but it is less adrenergic compared to the early gen progesterones, but it's very similar to progesterones such as like etonogestrel, for example. It's a very interesting compound. I mean, when I read the patent and the studies on Segesterone, this specific formulation is a really cool science behind it, where they actually, inside the ring, they'll have 2 cores containing the ethinyl estradiol and Segesterone, and they'll use silicone polymers to have that like extended release effect. And that's what really allows the ring to be reused, is because all the medication is not being released. It's being released very slowly over those 13 cycles, and it could just be reused. It's a very incredible, if you guys ever get the chance to read the patent on it, it's a really incredible read. It's really interesting. It just gives you an idea about the innovations and the extended release fields, which is very cool. Some things to know about the rings: they're contraindicated in patients with a history of CVD, certain hormonal cancers like endometrial cancer, for example. It's also contraindicated in patients with liver disease, such as hepatitis. This is just because of how the liver plays such an important role in metabolizing a lot of different substances in the body, including basically most drugs. So if a patient has a hepatitis or liver disease, that could compromise how well they can metabolize these formulations or these drugs specifically. So, and then specifically with Annovera, it has not been studied in patients with a BMI of over 29. Again, relates back to what we said about the patches. Patients with a higher BMI may not have the same efficacy with the current doses compared to patients with a lower BMI. In terms of adverse events, it's really similar to other contraceptives, such as, patients might experience nausea, bloating, headaches, or breast tenderness, for example. And in terms of failure rate, it's also at 9%, just like the patches and the oral contraceptives. So that wraps up our video on the birth control patches and birth control rings. I hope you guys all enjoyed that video. Next video, we are going to be talking about injectable birth control, which is very interesting. Anyways, please like, share, and comment on this video. Please let me know what you liked about it, what I could improve, and I hope to see you guys all next time. Thanks for watching.